Now let's talk about visual diagnosis, the tongue color. The tongue color refers to the color of the tongue body. The tongue body color almost always reflects the true condition of the body because it is not easily affected by other short-term factors. Its clinical significance, inspection of the tongue body color can help identify the thermal nature of the disease. The pathomechanism of tongue color is that the tongue color depends on the volume of the blood filling the tongue. If the blood overfills, then the tongue will turn red, deep red, or crimson. If the qi and blood are insufficient, the tongue body will become pale. If the blood stagnates inside the channels or the blood vessels are contracted due to pathogenic cold, the tongue body will become purple or blue. When the qi, blood, and body fluids nourish the tongue, it will be pink. But with cold, there will be lack of blood and it will become pale. And when the qi in the blood is obstructed, it will become blue. And when it stagnates, it will also be purple. When blood fills, it will become red because of the heat. And the yin injury concentrates blood and becomes crimson. And severe yin injury condenses the blood and turns it purple. The pathological tongue color can be divided into two general categories: more red or less red. The red color increases, it will look pale, pink, red, or crimson. When the red color decreases, it will be purple, pale purple, or blue. Pale tongue. The tongue color is lighter than normal. The indications of a pale tongue for cold syndrome: the tongue body will be moist and the tongue coating is thick and white, and the pathogenesis cold causes blood vessels in the tongue to constrict, which prevents blood from entering the tongue. In biomedicine, hypofunction of endocrine glands, contraction of terminal blood vessels, slow circulation of blood, lower basal metabolism, and disorder of digestive function all contribute to the formation of a pale tongue. For Yang deficiency, the tongue body is flabby and moist. The tongue coating is thin and white. The pathogenesis is deficiency of Yang, fails to lift qi and blood up to the tongue. And the indications for qi and blood deficiency: the tongue body will be small and dry. The tongue coating will also be thin and white. And the pathogenesis is deficiency of qi and blood fails to fill the tongue vessels and nourish the tongue. For red tongue, the tongue is redder than normal. The indications is of heat syndrome. For external heat, the tongue body will have slightly red or red tip or red tongue edge. The tongue coating will be thin and yellow. Pathogenesis is heat in body causes qi and blood to overfill the vessels of the tongue with fresh red color. And same with internal heat, indications is for excess heat, the tongue body is red and tough. The tongue coating is thick and yellow, and the pathogenesis is the same as external heat. For internal heat or deficiency of heat, the tongue body will be small, it will be red, the red tongue body with or without fissures. The tongue coating, there's no coating. The pathogenesis is the same as external heat. The biomedicine is a red tongue arises from inflammation of the tongue capillaries, dilation of the periglottis proper, or a concentration of blood or state of hypercoagulation in the tongue. Thank you for your attention.